Dr. Sportelli, obviously, you always want to be open-minded. What's your perspective on the Sinclair Method?
In order for this to work, you're relying on this conditioning and extinction. And the only way that that works is if the person is willing to take that pill every time they're about to drink. Now think about this, though. You're asking a person who's addicted to the euphoric experience of getting drunk to take something to stop that euphoric experience. And the only way it's going to work is if they continue to take it regularly and consistently when they drink.
I think we're setting up a false choice, and that is we're pretending that everybody who is a fall-down drunk is ready to quit. What I'm saying is, if 90% of people are actually not willing to go into the sort of treatment that we wish that they would go into, why not have an alternative method in place that at least reduces it? So just so you know, we have treated people who are daily drinkers, and within days of trying this thing, they're drinking half as much as before. I call that progress. Is it where I want them to go? Not necessarily, but it's a huge improvement over the sort of drinking they were doing just a week earlier. And if they can see what it's like to not be as drunk on a regular basis, maybe they choose to stay with this system and it works for them long term, because some people use this to quit, not to moderate.
I think the important thing is patient screening and close monitoring. And I think, you know, it's very uncomfortable for me to think that we could send somebody home with a bunch of pills and say, take this pill when you're about to drink and you'll probably stop drinking, or maybe you'll cut down. I think it needs to be much more closely monitored.
But I think you're both in agreement that there is a place for naltrexone in dealing with alcoholism, whichever method you choose to use. I mean, do the studies support that?
Yeah. There are long-standing studies that show reductions. I mean, Vivitrol is an injectable form of this. You talked about it. For opiates, that's actually how this got discovered. Yeah, look, whatever works, right?
And I think the important takeaway here is that when you're talking about 90% of people abusing alcohol or not seeking help, it's such an individual experience when you're abusing a drug or alcohol, that if you can just reach out for help, and I always say the more options, the better, but you just better make sure that the option you're using is right in your particular instance. That's why we wanted to have this discussion. I really appreciate both of you offering your input. Dr. Sportelli, thanks for joining us via Skype. Dr. Jaffe, thank you as well. We'll be right back.